Dysphagia is the first symptom of esophageal cancer. See your GP without delay. Cancer prognosis improves with early detection, which makes symptom awareness front and center. Worryingly, esophageal cancer often causes signs that are hard to spot. Fortunately, a doctor shares the first red flag that could break the news of a tumor in your esophagus. The position of an esophageal tumor, which starts in the tube that connects your mouth to your stomach, means that symptoms often crop up when you eat. According to Dr. Deborah Lee from Dr. Fox Online Pharmacy, the first symptom of esophageal cancer is usually dysphagia. Dysphagia, i.e. difficulty swallowing, describes taking more time and effort to move food or liquid from your mouth to your stomach. Dr. Lee said, esophageal cancer usually starts at the lower end of the esophagus. The cancer develops there probably because it is the site of acid reflux, and it grows slowly in this very acidic environment. As it grows, it blocks the lower portion of the esophagus, meaning it becomes hard to swallow. Food seems to stick in the throat, sometimes causing discomfort, and coughing, feeling sick, vomiting and dribbling saliva. Other food-related symptoms like nausea and indigestion can start cropping up as well. Your appetite can also take a hit and you might start losing weight as a result. Apart from these symptoms, other telltale signs of esophageal cancer include heartburn or acid reflux, symptoms of indigestion, such as burping a lot, cough that is not getting better, hoarse voice, feeling tired or having no energy, pain in your throat or the middle of your chest, especially when swallowing. If you have any symptoms of esophageal cancer, you should see your GP without delay. Dr. Lee said, if your GP is concerned, they will refer you to the hospital to have an endoscopy, a telescope in a thin tube which is passed through your mouth and down into the esophagus to take a closer look. A biopsy, a small sample of tissue, can be taken from any abnormal areas and sent to the lab for closer inspection. Further tests such as a CT scan, or an endoscopic ultrasound scan may be needed. Esophageal cancer is treated with surgery to remove the tumor and sometimes insertion of a stent to hold the esophagus open and allow the passage of food and liquids. Chemotherapy and radiotherapy may be required. How to reduce your risk of esophageal cancer? From quitting smoking to cutting back on alcohol, there are many lifestyle tweaks that could help reduce your risk of esophageal cancer. Dr. Lee said, it's time to stop smoking, minimize your alcohol intake, and lose weight. You also need to eat a healthy diet which contains large amounts of fresh fruit and vegetables. Make sure any reflux is properly treated. Don't drink excessively hot drinks. Your GP can provide advice and support to help you achieve all these things. Act now before it's too late.